Good. Keep those legs going. Now, speed it up. Let's go. 6, 5. Remember, you're not squeezing your grip. You're just trying to pull up. Work it. 4, 3, 2, jump jacks. I love aquatic physical therapy because every day I get to see results in my patients. I can see a patient in extreme pain. They come into the pool after the session. They are in less pain, they're happier, and they're ready to carry on their lives.
We work with many different types of patients with neurological conditions, but we also work with people who have neurological problems. This might include people who have spinal cord injuries, people who've had a stroke. We work with many folks who have Parkinson's disease. And the water is such a unique environment for people to move and begin to learn to exercise more efficiently. So for example, people with Parkinson's disease, movement is difficult for them, their balance is often a problem. The water provides a very safe environment for them where they aren't going to become injured. If they fall to the side, it's very safe so they can challenge themselves to new things. They can begin to move more easily in the water, and this carries over into land with improved movement when they return home.
There are lots of important physiologic benefits of using the water for rehabilitation. First and foremost, I think it feels good. At the same time that it feels good, you're offloading the joints of the body because of the buoyancy in the water. You're decreasing the workload of the heart because the cardiac output increases and stroke volume increases at the same time that it usually decreases heart rate. It improves circulation to the muscles. It decreases the stress level in the nervous system and causes a feeling of relaxation.
I see children who struggle to move on land. They're not able maybe to hold their head up, they're not able to sit, they're not able to stand, they're not able to walk on land because they just haven't matured to the point that they can do that yet. However, if I can get them in the water allows them to float. The buoyancy factor helps them control their body better. I can see sitting and standing and walking emerge in a child in the water much sooner than I can see them on land. The other thing about the water is that the child loves the water. Children love to splash. They love to be in the water. They feel free. It looks to me, the parent says, like you're just playing with them. And I say, well, I am playing. That's the child's job, is to play. My job as a therapist is to be strategic and to help them learn how to move better, enjoy the water, enjoy the freedom, but progress their motor skills.
But as far as the therapeutic aspect, my athletes got better. And it was maybe a natural route, not necessarily a direct route, but people get better. And we find that we can work folks a little harder. We can actually use the factors of muscle strengthening, muscle endurance, and those upgrades to get folks better. So they get better in the water, and that is truly the piece.
We would train athletes, particularly the middle and long distance runners, using the pool for maybe 30% of their training volumes. We also used it, of course, when they got injured, and I was astonished at how fast they became healthy, well, and functioning afterwards. But I was even more surprised at how fast they returned to performance levels that even exceeded where they were before.
With the geriatric patient who is in pain and stiff, maybe has a new knee or a back injury, the water takes the pain away, it loosens the joints, it makes muscles much more pliable. You just see people smile, they become animated, and for a senior who's struggling with pain and the isolation of becoming disabled, water therapy is the way to go.
Aquatic physical therapy is phenomenal for getting results to a variety of different patients.
And everywhere I look in the pool, I see smiles. When I go down to my physical therapy gym, I don't see smiles. I think that that's a very important piece.
And that's what we want to see. We really want to improve the quality of people's lives, and the aquatic environment is just one of the very, very best for accomplishing that.
Good job. Okay. Keep bicycling legs. Bicycle. Good. Good job. That's it.